Good morning to one and all. Myself, Dr. Gulwish, Assistant Professor, Department of Physiotherapy, Faculty of Paramedical Sciences, Rama University, Kanpur. I'm here to demonstrate or to shower my words of wisdom on the topic medicine and ethics. So basically, we will be dealing about various things which are present in the topic medicine and ethics. So first of all, let us discuss what is ethics. So introduction. As we all know, medicine in ethics is a subject or is a science, is an applied science which basically deals with the scientific aspects as well as the clinical practice which is based on ethics in medicine. Okay, let's now focus on what it is. What is ethic is actually about. So ethic is basically, it is a term that is used in Greek words that deals with specially decision making policies in certain society. Now, as we have already written a Greek word, this means ethos. Ethos basically describing custom. The custom. So basically, it is a practice which a healthcare professional deals in every aspect whenever he is busy making decision for the patient as well as, or he wants to actually practice in a given sort of hospital's administration as well. So now ethics, just like we are talking, it covers a wide range of moral norms. It covers a wide range of moral norms Basically, norms are built so that how to be in a situation for a respective professionals. So first of all, let's discuss about what are the basic criterias in which a healthcare professional needs to be very active. He should be very thorough with the decision making policies, and also he should avoid the misconduct, conflict as well as confusion. So that is why ethics is being built, or it has been, since 1803. It was a work done by an English publisher, an author whose name was Thomas. So he has already published a work which was done on ethics, so that a professional, a healthcare professional, a team member of its team can sustain in that environment without harming any patient's decision making, or without harming anybody's norms regarding the society or the customs which are prevailing in his or her life. Okay, let's now talk about what are our actual 4 pillars that medicine ethics is based upon. So there are 4 pillars on which ethics is based upon. Number 1, these tenets which we are going to be talking right now plays an important part in choosing what is the right and wrong for a patient. Okay, so the first pillar that we are talking about is beneficence. Beneficence is actually where you are doing good to the patient. Now, good doing to the patient, how can we do good to patient? Number one, we can actually, whenever a patient come to us, we can actually see or assess his condition, and we can demonstrate whether you have come to a right person or you need to be directed somewhere else. So for somewhere else direction, we will be referring to beneficence. Okay, beneficence states what you can do good for the patient. So not only in terms of guiding, you can also formulate basic principles and protocols for the treatment, in which a patient can sustain your treatment and survive according to that. Okay, now what all good you can do? You can always, whenever a patient, in terms like we are talking about ethics in terms of physiotherapy, so like a patient is coming to you and you are assessing that the patient needs somewhere your guidance regarding his activities of daily living, what he was pursuing, he needs to be modified in that sort of activities. So what you are going to do, first you have to just look into the matter ki what is the problem basically is. Now you have to look for the condition and severity. What is the condition and severity the patient is suffering from? And whenever you know he is the only and actual person in this inside the family who has to earn his bread and butter, so for that, if possible, you can actually modify his activities of daily living. For those especially who are, for an example, for those who are actually a tailor, so basically if there is a spasm in his sartorius muscle and he is not able to swing or stitch the clothes, so for that it is very impossible to survive in that environment. So if a patient comes to you and you seek such emergency condition in that patient, so what you are going to advise, you are just going to tell ki you can actually modify your activities according to that. So beneficence is all about what you're doing good for the patient or what you're doing in return good for the society. Okay. Number 2, we will be talking about autonomy. So basically autonomy is the term where a person has a right or a patient has a right to choose whether the treatment, if you are going to provide him, is good for him or bad for him, or he wants to or he wishes to choose that treatment itself or not. So autonomy helps, gives a right to the patient to actually choose between the treatment what he has to be given. So this is basically an autonomy. This is also very beneficent and important and has a significant role, as patient could himself or herself can involve whatever you are formulating a protocol, and he or she can be able to tell whether he likes what you're doing or there is some sort of abnormality in whatever you are giving, or the patient needs to change in his whatever your protocol you are making him do. Okay, so this is, we are talking about autonomy. Number 3, non-maleficence. Non-maleficence is a term where it describes you are not doing any harm to the patient. So how come you are not doing any harm to the patient? By actually making whatever you have as part of the knowledge on the basis of the treatment that you are giving, whether he should opt for that or there is something like a sort of equality. What is right to equality? Right to equality is you need to describe and tell patient, you had to make aware patient whatever the choice is he or she is making regarding the treatment is right or wrong for himself. It's the you who can be a part of that, and you can guide the patient whether the part which he is taking or the treatment which he is going to go through is good for him or bad for him. Will that be suitable to him or not? Okay, rest whatever you can see, you can always, there is always a right for a therapist, because you have to be in that environment where you have to protect everybody's right. So under non-maleficence is something like confidentiality. So what is confidentiality? Is basically you have to be very much aware, you need to be very much aware when you are treating a patient, that you have to ask and make sure whether the treatment which you are giving him or his, or whatever the disease or disorder he is going through, will he wants to describe or tell that to other people or not. So there is always a masking between the treatment which you are giving and also there is a masking between the treatment which he is getting and the treatment which he wants to get. Okay, so again, now what all you can do before, if you want to make his documents to be circulated inside or outside the public environment, first what you have to do, you have to just see ki whether he wants to do that or not, he is cooperating with you or not. If he is not suggesting to go for that, you have to just stop that. So again, one more thing that you have to utilize in this is informed consent. So whatever the way you are going to treat that patient, or whatever things you want to have or change or modify, you have to, first of all, you have to give a form to a patient and you have to see whether the patient is willing or not. So how can you check that whether his patient is ready to opt for that treatment or not? He or she has to sign that informed consent. If he or she is ready to sign that informed consent, so this means the treatment which you are going to give is the patient has already made it a decision on it and is now being a part of your treatment, and he is ready to do what you are doing. Again, now the fourth term, that is justice. So what is justice? Justice is basically, it's a right of a patient that you have to treat, whether a patient is out of your caste, creed, or whether whichever sex he belongs, you have to treat everyone as an equal. Okay, so the treatment protocol what you are going to follow as well as what you are going to formulate will be just same the way you are going to treat for an upper caste and the lower caste. So it all comes under justice. So this is all, we have all submerged and made a topic which is based on medicine and ethics. So these are the norms and the moral values and principles that a patient or healthcare provider needs to go through before implementing any sort of decision or forecasting any sort of treatment. So this is how you are going to look for the further aspect, and you have to go through the same for each and every environment or any situation which is based on such sort of norms. Again, this ethic is not only great for how you are going to survive in certain sort of environment, but also it will not only respect your professional, as well as you will have to respect and acknowledge, and also you need to be given a dignity by this. And because certain things are going to be under certain criteria, one has to be very clear in his mind that before formulating something you need to concern such ethics, and this ethics has been published worldwide and everybody has an accordance with that and has been accepted what the term ethics is. So before formulating anything or to certain survive in certain sort of environment, you have to just go through what is basically norms of ethics are. So here I am going to end my topic for medicine and ethics, and I will be very grateful if you go and look for this, and please be very diligent in asking some sort of questions if you want to, in case it has been in your mind as I am explaining to you all. So thank you all.